Hello, how you doing? My name's Curtis with North Collier Fire Rescue. I'm a paramedic here at the department, and today we're going to discuss the basics of CPR and how to handle those emergency situations. So first things first, the country has adopted a new policy where it's called no, go method, which it's dispatch-assisted CPR training. So we're going to discuss that today. So first things first, if you ever find a citizen or someone you know unconscious and unresponsive, the very first two things we always want you to do and recommend that you do is start by calling 911. I always recommend that everyone seems to have cell phones these days. You pull your cell phone out, dial 911, put it on speakerphone, and set it down next to you and the victim. The dispatchers are trained to walk us through CPR and the care that we're supposed to deliver, so they'll immediately start helping you with that. The very next thing we always recommend that you do is if you're in a public setting or somewhere where there's a possible chance that there's an AED, have someone go grab the AED. Use clear and concise communication when asking someone to get that AED, so that way you know that task is being accomplished. AEDs are everywhere now. There's several companies that you can buy them from. Once that 911 has been called and an AED is on the way to you and your victim, we're going to assess the victim. So first things first, we use the philosophy no, go. So no to conscious, right? So if your victim is unconscious and unresponsive, that's one no. The second no is breathing. Is your victim breathing? How do we assess breathing? Simply this. We look for their chest to rise and fall. If they don't have any signs of normal breathing, that's another no. And now it's time to go. So now we will start initiating our CPR care. In the country now, we're teaching hands-only CPR. So with our adult victims especially, we're not worried about ventilating our victim. We don't recommend that you do mouth-to-mouth. We recommend that you focus on chest compressions. A high statistical chance of an adult victim going in cardiac arrest in this country is driven by a cardiac disease. One of the most common ones that we refer to is heart attack. So that's why we focus on rendering care to the heart, all right? So the first thing first is we want to find our landmark on our adult victim to know where to put our hands to perform the chest compressions. We all have a flat breastbone, sternum, going down the center of our chest. We want to put the base of our palm in the center of that chest, lower half of the breastbone. Once we find that landmark, you can choose whichever hand you want to be on the bottom. You're going to put your other hand on top. The key to this is using good physical mechanics. So we want to make sure our weight is on top of our victim. And then we will lock our elbows out and we will drive down on the chest. The rate should be anywhere from 100 to 120 chest compressions a minute, right? We've all heard the song Staying Alive by the Bee Gees, so you can refer to that song to be to the beat of their compression rate. You'll start those chest compressions and you will continue those chest compressions until help arrives, right? Like I said, the 911 dispatchers are going to help remind you what to do so you'll never be alone. They're highly trained and skilled in trying to keep you calm and effective. Once paramedics get on scene, continue chest compressions until they tell you to stop. All right? There is a chance that there could be a two-person crew that was nearby that jumped the call and got there very quick, and there's just two of them. So they might utilize you as a rescuer. So please resume chest compressions until they instruct you to stop. So for our children, a lot of things remain the same. One of the very first two things that you'll do just with any other victim like your adult victim is you're going to start out by calling 911 and also having someone retrieve an AED if possible. Same thing, pull your phone out, speakerphone 911. Where things vary differently with kids compared to adults is how we perform those chest compressions. So we still find the lower half of their breastbone, center of the chest, but instead of needing both of your arms locked out, elbows locked out, and driving down on your victim, they're obviously much smaller. So instead, we recommend that you use what we call the two-finger method. You take your two fingers, put them on that landmark, and you do chest compressions like so. The other way to do the chest compressions is what we refer to as the two hands, thumb encircling technique. Wrap your hands around the victim's back, your thumbs come to the chest, and we can do chest compressions like this. It is always optimal to have your victim laying on a hard surface, so that way the chest compressions are more effective. Choking victims. Obviously, it's for serious concern. If we stop breathing, eventually our heart will stop as well, which will inevitably lead to cardiac arrest. So we need to help our choking victim and relieve that choking object if possible. The first thing I like to do as a paramedic when I get on scene is I like to approach my patient and ask them, are you choking? If they say yes, there's a strong possibility that they're not actually truly choking with a full airway obstruction. If they are not able to talk, they'll probably try to do what's called the universal choking sign, where they'll put their hands around their neck. They'll definitely get the point across that they are choking. Once they instruct you that they are choking, it's time to start to help them. The very next thing I do is I tell them exactly what I'm going to do to them. I tell them, face the same direction that I'm facing. I grab them from behind, give them a big bear hug. I make a fist with one hand, wrap my thumb on top of that index finger. With my other hand, I'm finding their navel. I go a few inches above their belly button, and the bridge of my thumb will sit right there in that landmark. My other hand grabs that fist. We do what's referred to as abdominal thrusts. So once you've gotten to this position, you're going to squeeze in and up simultaneously, as hard as you possibly can, over and over and over, until one of two things happens. The object comes out, patient starts talking to you. That's great. The other alternative option, unfortunately, is if they become unconscious and unresponsive, we're now going to lay them down onto a hard surface, and that is where we'll start our CPR. Choking for children can be a little different, just like our chest compressions can be a little different. If we have a child, let's say 5 years old is a good example, a lot of times you can do the abdominal thrust just like I showed you on the adult. They're a lot shorter than us typically, so if you need to, just get down on your knees and perform the abdominal thrust that way. If you're strong enough, you can hold them up and do the abdominal thrust, but either way, you'll do it the same way as we did with adults. When they become an infant, all right, if they're 1 or less is what AHA recommends, that's when our care is going to change. We're going to perform 5 back slaps followed by 5 chest thrusts. Reminder, if the patient is conscious and responsive, right? Anytime you have a choking emergency and your victim, regardless of age, is unconscious and unresponsive, we'll perform CPR. So this is for an infant who is conscious and responsive. The very first thing we do is, with our non-dominant hand, we grab underneath their jaw. Baby will go face down inside your forearm. We find the upper center part of their back. With the base of our palm, we're going to give 5 back slaps. 1, 2, 3, 4, 5. Do not be afraid to be aggressive. We have to be aggressive to hopefully relieve their choking emergency. Grab the back of the head, rotate the baby over to face up. We find the lower half of their breastbone, center of the chest, and we give 5 chest thrusts. 1, 2, 3, 4, 5. Grab underneath the jaw, rotate back over. So baby is back where he started. Find the upper center part of their back, and once again, 1, 2, 3, 4, 5. You'll do that over and over until one of two things happens. Baby starts crying, you know the choking has been relieved, or unfortunately baby becomes unresponsive and unconscious, where then you will lay baby down and start CPR.